COVID-19 activities and response here in Washoe County. As most of you are aware, we now have two presumptive positive cases of COVID-19 in Washoe County. One, a male in his 50s, another a male in his 30s. Both are being isolated at home. Both of these cases have resulted from travel outside of the area. The initial case that we had was from the Grand Princess cruise ship. That person was a passenger on the first leg of that ship's journey when they traveled down to Mexico and returned to San Francisco and deboarded from the ship prior to the ship going to Hawaii and back. The second case had a travel history to Santa Clara County, California. They are experiencing a number of cases in Santa Clara County, and so that travel history is, I think, important to understand as far as that second case that we became aware of late Saturday night. We've conducted case contact investigations with both of these individuals, and the case contacts that have been identified, the close contacts, are being quarantined, so self-isolated for the 14-day incubation period from their last contact with the case. And we did have several individuals that did have symptoms, and so we had them tested, and I'm happy to report that all of those results have come back negative. So they'll continue to be in self-isolation for that 14-day period, but it's a relief to know that the symptoms that we did see in those cases are not COVID-19, so we don't have any local transmission that we've identified at this point in our community. We also, I didn't mention, had good news from the Huffaker school closure. So the students that we were concerned about were tested on Friday, and they also had negative results, and so that school is back in operation for our community. We have set up procedures for being able to have people be tested for COVID-19. We're still in a situation where we are working to identify people that we think are the highest risk of potential for COVID-19 and working with them to have samples collected and have them tested so that we are preserving our lab capacity for conducting those tests through the Nevada State Health Lab. And we're prepared to continue to operate what we're calling the post, our point of screening and testing, where we can bring people in, and we've set up a mechanism for people to basically do a drive-through type of an approach where they're in their vehicles and we're collecting samples outdoors so that we're keeping them out of healthcare facilities for that testing to protect our healthcare workforce and delivering those samples to the state lab. So those were the points that I wanted to provide for you today, but I'm happy to take any questions.
Are we able to talk about where these two cases, these people worked at, and what steps are you taking to make sure that those locations are properly sanitized, and are you keeping an eye on anyone else that might have been in contact with those locations?
Yeah, so we are working with locations of employment so that they can identify, if they work with us in identifying any potential employee exposures, as well as work on the workplace approaches if disinfection is required there. I am not making that information public. We actually had a conversation yesterday with the media on this issue, which I think is important that we repeat. The health district receives confidential information both from the federal government as far as people that were traveling to and from China and people that have been on cruise ships, et cetera. This is information that's provided to us through an encrypted link that we have to have federal security credentials to access, and so that's confidential information. The information that we collect during our case contact investigations is HIPAA-protected medical information. And so the health district, because of our role to investigate and control the spread of communicable diseases, is provided the privilege of receiving this confidential and private information. And in order for us to be able to continue to exercise that privilege, we're required to make a determination that if we release information that comes to us in that confidential manner, that it's to serve a public health need, to help protect the public and to be of benefit to them. And so what we want to avoid is putting out information that then eliminates the anonymity that people deserve if they have been exposed to COVID-19 or if they are a confirmed case, similar to how most of you, I think, would want to have your medical records be private and not shared with the community. And so we will put out information that is important for the public to know, be well aware that behind the scenes we are working as part of that case contact investigation with employers and et cetera. If it comes up in our investigation that there are office places or other facilities that are impacted and we need to be working with.
Have we received any additional? Please use the mic. I'm sorry, Ben grabbed me first, so I'll pass it around though so everyone can hear online.
And with regards to the testing, can you give us a sense of just how many tests have been done here in Washoe County to this point?
I'm sorry, but I don't have that figure on the top of my head to provide to you. But I believe if you were to contact the state health lab that's conducting the tests, they could give you that number. I would, I guess, add also that when we began with the testing and with CDC, there were restrictions that had been placed upon who would be allowed to be tested. And so during the past week, CDC has lifted those restrictions on the testing and allowed for us to make determinations locally about who are the priority individuals for being tested. And so in addition to the post sampling and testing that we're doing for people coming to us, the hospitals are also involved in sample collection of patients that they have hospitalized in their facilities or that present in their emergency department that they consider to be high risk. But I would also like to remind the community that we would like them not to go to the emergency department or their healthcare providers' offices because they want to be tested. What we want people to do is to contact us through our local line 328-2427 in order for, if they have symptoms, to contact us there so that we can work with them to assess their symptoms and the potential risk that they have of COVID-19 to be able to get them in our sample queue or identify them as a lower risk and work with them about how to communicate with their healthcare provider prior to appearing in that office. Or, and I know that we have had emergency departments that have been overwhelmed with people appearing as we put out information about COVID cases. That diminishes their ability to provide care to the people that are most in need, that have an emergency situation going to the emergency departments. So I ask people, please don't don't go there, call our number and we'll work with you. We are currently operating that number 8 to 5 and are referring callers to 311 after hours. We're working to see how we can expand our capacity with that line to provide more information and interaction with the community after hours. But as I've explained to many people, we are building this plane while we're flying it, and we're going to continue to build it. I think we've got it in the air, but we're working on how we can improve things.
Have we received any additional test kits?
The state lab has adequate capacity for us right now, and they have set up a resupply to be able to maintain the capacity that they currently have into the future for us. We're also working through the governor's office for additional kits to expand that capacity in the future. And CDC has, through the news that I've seen, been reporting that they are dramatically increasing the number of kits that they're providing. So we hope to see that capacity expanded in the future as well.
But just to clarify, as of right now, we have not gotten another kit.
No, the state lab has received additional kits, and they have a plan moving forward for being able to get new kits in the future to be able to sustain a level that we have, the capacity we have now.
Do you have an update on the status of the other residents who are on the Grand Princess cruise?
So the other residents that were on, I'm sorry, could I ask clarification? Are you asking about the other ones that disembarked previously in San Francisco?
that the health district identified and had reached out to.
So, so we have been working with the passengers that disembarked originally from the ship after it had come back to San Francisco to Mexico. And so I believe that now the quarantine period is over for that initial group of passengers. But as I think everybody has seen in the news, we have all of the passengers that are on the Grand Princess cruise ship with its arrival back from Hawaii. And so we're currently working through the state with the federal government on how those passengers will be managed for quarantine in Nevada. I have heard through those communications that all of the Nevada passengers that are on that cruise are asymptomatic, so they don't have symptoms of COVID-19. So that's good news that we just recently heard.
Can I just ask a quick follow-up, which is how many Nevada residents are on that cruise?
The latest number that I heard was 49 Nevada residents.
So there's been a fair amount of panic buying out there of water and things like that. What would you say to people who are doing that in terms of what they really need to be focusing on in terms of their priorities, and what, if anything, is the county saying to businesses about taking precautions?
So we're messaging to all of our citizens and our businesses to be taking precautions and to be planning for this, to be prepared. So you've heard me repeat numerous times that the best defense for us for COVID-19 is to exercise the same precautions that we do to prevent the spread of influenza. So the hand washing, the coughing in your sleeve, trying to avoid touching your face, cleaning high contact surfaces regularly, social distancing, having people not come in when they're sick, and telecommuting type practices. So to the extent that we can have businesses preparing for continuity of their operations, if they do have people that are out sick, and accommodating people to be able to work remotely if that's feasible in that type of business environment, those are important things to be doing. As far as hoarding of water and other things, we are encouraging that people work to maintain a supply of food in their pantries and that sort of stuff, but not to be stockpiling large amounts of materials. And as far as water goes, it's important for people to be prepared for emergencies and disasters, and we always recommend for people to have several days to a week's supply of water on hand in case we have a big earthquake or something like that disrupts our infrastructure. If we have COVID-19 cases, that's not the same type of an emergency situation. And so we have excellent tap water here that Tumwa provides. And so I always encourage people to drink tap, and I would not foresee any disruption of our drinking water supply that we get through our faucets coming forward. I think that the messaging that I've heard that I think is one that's more appropriate for our community is, instead of going to the store and trying to clean out the shelves to fill your basement with food supplies, maybe buy a few more items every time that you're at the store and have a reserve on hand. But I don't see any immediate disruption to our food supply system that's coming our way.
So one just quick question about the new case, 30-year-old man. I know a lot of that information is confidential, but there's no worry right now about any family members, any kids that might go to schools like the other case?
So the close contacts did include several household members, and they are being quarantined that 14-day period for us to be able to monitor them to see if they do develop COVID-19 during that period. But we don't have any immediate concerns at this point regarding those family members.
Okay, and then really quick follow-up. You mentioned something about drive-through testing to prevent people from going to local health centers, things like that. Can you talk about just what's going on with that right now? Can people do that today? And just a bit more of that testing method.
Yeah, so that is, it's not just open to the public to show up and drive through and get tested. It's based on the work that we do with people contacting us as we've asked them to in assessing their symptoms, work that we do with healthcare providers if we are contacted by physicians with cases that they're concerned about because of their travel history or potential contact with somebody that may have had COVID-19. So we're prioritizing those people for testing, and we're communicating and coordinating with them for when and where to show up for that sample collection to be tested. And so I think we have a good system in place. We are not doing the full post today because we didn't have enough people on our list from yesterday that met that criteria for the testing. So we do have a few samples that are being collected today, but we're not doing the full stand-up of that system today.
And just to confirm the two presumptive positive cases, when will we know when that makes a transition into if they do have COVID-19 or if they have been cleared? And are all the other family members now cleared, or are they still being considered, in quarantine and having tests run on them for a possible presumptive positive?
So the two pieces to that question. As far as when we would get the confirmatory test results back from CDC, I don't have an answer for you. The CDC, I think, is backlogged and running numerous tests from all over the country. And last I had heard, Clark County had not received any confirmatory test results from their case, which they had tested prior to our case. So we will let the public know, let the media know when we do have confirmatory results. But based on the testing that the state lab did with CDC preliminarily, when they set up the test procedure at the lab and got it up and running, we have a high confidence in the presumptive positive test results that we received from the lab. We are operating as other public health agencies are across the country and relying on those presumptive positive results for us to take action while we're awaiting CDC confirmation. And then there was a second. Was there a second part to that? Oh, the family members that were in households with the COVID-19 cases, they are still in that 14-day quarantine period. So we'll continue to monitor them for symptoms and assess their situation to ensure that they don't develop the COVID-19 disease during that period, or if they do, that we then take appropriate actions with their continued isolation until they recover.
There are politicians, both locally and nationally, telling people to continue going to concerts, keep going to restaurants, keep buying flights. Is that in line with the guidance from the health district right now?
We yesterday made a statement about people considering what their travel plans are and being cognizant that we have had people that have traveled outside of our area, even domestically, that we have now appeared as COVID-19 cases in our community, and to consider that. Right now in Washoe County, we have a very low potential for somebody to be exposed to COVID-19 here in the community. And so we're not taking any steps to make recommendations about public gatherings with concerts and things like that you mentioned. But I would also remind you of the guidance that came out from CDC in regards to our older population, over 60, recommending that they avoid some of those crowds and gatherings, that they reconsider travel plans, et cetera, because of what we've seen in that population as far as the severity of COVID-19 to them when they get that. And so there's extra precautions that are being recommended for that older community because of the potential for poor health outcomes for them and higher fatality rates that are occurring in that population when they do contract COVID-19. But I would also say that we don't know that elder population is any more susceptible to contracting the disease than other segments of the population. And I think that's what we see with the 32-year-old case that we have in the community, that younger people can get COVID-19 as well.
With Quest and LabCorp starting to test Nevadans in the near future, how will those results be reported back to the public? Will they go through the health district, or how will people be kept apprised of those results?
Thank you for that question. The state has taken action through the Division of Public and Behavioral Health to establish COVID-19 as a reportable disease. So there's a whole list of different communicable diseases that when a lab tests and gets a positive for those diseases, they're required to report that to the health district so that we can have that information and do the appropriate investigation. So I applaud the state for taking quick action to make sure that is reportable to the public health authorities, so we'll get the information from those lab results.
You talked a little bit yesterday about the funding that you're seeking from the bill that was passed in Washington last week. And do you have any more information on how much you're seeking and when it's coming and what's going to be spent on?
So we have made several funding requests, and Some of them are aspirational, perhaps. I don't expect to get everything that we ask for, but you don't ask and you don't receive. So we have been working with the state. One of the federal funding areas that we receive funds from is the Public Health Preparedness Program. And so we have made a request to the state of additional funding through that program for shorter-term needs that we have for staffing and supplies and other things of about $190,000 through those funds. We had an opportunity to also provide our, through NACO, the Nevada, or the National Association of Counties, and our Nevada contingent, a request back to the government on what our needs would be for that. And I believe that the health districts, what we put together for that was about $4.4 million. And so that's why I say an aspirational request. I don't expect that we'll get that much funding. But that was for looking at what potentially could unfold from this and not what we're seeing now in our community. And so what I do know is from the $8.3 billion of federal funding that have been signed off on by the president, $950 million of that are for state and local public health authorities. And doing my back of the envelope calculation on that, if you look at the current national public health preparedness budget of about $650 million for state and local health departments, and you scale that to that $950 million, if our allocation was consistent, we'd end up with somewhere around $1.4 million out of that bill. But we'll wait and see what we're able to secure.
So I've seen this question pop up a couple of times on Facebook. Just want to set people at ease. Can people be carriers for COVID-19, the coronavirus, without showing any symptoms?
Our understanding is that there is a possibility for people to be carriers of COVID-19 without having symptoms. As we're all aware, this is a brand new disease that we're still trying to learn about, and we don't have a complete understanding. But while they may be able to have the disease without symptoms and transmit it, our understanding is that if they don't have the symptoms and are not real sick with it, we don't expect them to have the same viral load that somebody that was symptomatic would have. And so if there were spread, we would expect it to be much less if people don't have symptoms. And so our focus now is on individuals with symptoms to be able to identify them, because we believe that that's the significant threat if they're in our community.
Any other questions?
I guess there's one. I'm not sure if you addressed this earlier, but anything new in the school district?
There is nothing new as far as what we're seeing as far as any risk in the schools from COVID-19. We're, as I mentioned, quite relieved with the negative results that we had at Huffaker. But we are in close contact with the school district. I appreciate the open and immediate communication that we have with Superintendent Dr. Kristen McNeil and her staff, and we'll continue to coordinate closely with them as we move through this situation.
Any more questions?
All right, thank you very much.